Today I'm just going to be talking about the DermaRoller. And the DermaRoller is also called microneedling, and it is just a type of collagen induction therapy. So it's a way we can stimulate collagen in the skin. And really all it is this device we see here in the corner. Just a little handheld roller with multiple little needles, and you can get varying depths, varying lengths of those needles from 0.5 to 2 millimeters. We use the 1.5 millimeters, so obviously the longer the needle, the deeper the holes will be. Just roll it across the skin, creating these micro holes. The ultimate goal of that is stimulating the production of collagen. And after you do the DermaRoller, you've created these micro channels in the skin, so that kind of gives us access to the more active layers, the dermis, which we can use, apply like growth factors. The TNS recovery serum is a great one, and also acids. You get that enhanced penetration and greater efficacy of the product. We use it to treat scarring, primarily acne scarring, but really you could use it on any type of scar. It can improve stretch marks. It can reduce wrinkles because it is stimulating collagen, and overall improve skin tone and texture. The benefits of the DermaRoller versus the laser therapy is that there's no heat. So anytime we're treating a darker skin type or conditions such as melasma, where you have very labile melanocytes, if you use a heat source such as a laser, you can potentially stimulate them to produce more melanin, and the result is they can be hyperpigmented after the treatment or a worsening of their melasma. With this, you have minimal risk of hyperpigmentation because the absence of heat. We can use it on any body part. I've done it on abdomens, I've done it on upper thighs of skin type 4s, and they've had no problems. And minimal downtime, so the skin really heals within 2 days. They'll be red for the first 2 days, but beyond that, they can really go about their business and not have any problems. And it's affordable, so instead of having to buy a $120,000 laser, we just have to buy these little handheld devices. And obviously the cost is our own time, but for the patient that translates to more affordable treatments. And additional benefits, you get continued neocollagenesis for up to a year after treatment, so you will see an improvement. And for conditions like severe acne scarring, this isn't going to erase that. I mean, Dr. Patrician's always said that's one of the hardest things we treat, even with laser therapy, but we can at least get some improvement of it. And yes?
When you're doing it, are you using anything at the time after you DermaRoll?
I do the acids. Yeah. Yeah. For almost all the patients, unless they have really sensitive skin, I would just do the recovery serum. But most of the people who are getting the DermaRollers that I've seen, they're acne prone, and so I do acid. Just nurse, yeah, that's what we do. But I think you were the one that was saying that they're using it for melasma with the TCA even. And I even thought, well, maybe they could do it with Levulon too. I haven't read any research on that, but because you have those channels that enhance penetration. So David is I'm gonna demonstrate it here on David.
So I just clean it really good with alcohol first because they do numb for this.
Look how she pulls his hair.
And then really this is all it is. There's no pressure, just the movement. And I usually will go for about 30 minutes or like 10 to 15 minutes per side or patient tolerance. So sometimes people, some of the women with thinner skin, they can't tolerate it as long as some of the guys that have thicker skin.
Is it painful?
Not at first, but as I keep going, it will get a little more tender.
Even if it's numb?
Yeah. So it's the same concept as the DermaPen. I mean, poking micro holes in the skin, just technique is different. With the pen, it's more stamping, and then this is just, you know, rolling. And that's it. I mean, this is like this for like 25 minutes.
Do the forehead.